So we still have about 2 minutes before we officially start. You all go ahead and place your name, campus, and your professor's name in the chat. Name, campus, and professor's name in the chat. We do have a PowerPoint and we can follow that. If there are any questions or concerns, just, please feel free to stop me or put the message in the chat. So we do want to make sure that we have, you've downloaded your exam prior to coming on for exam. And your camera doesn't have to be on, Ms. Williams, unless you just want it to. Okay. Um, ensure that you've downloaded your exam prior to coming to class. That ensures that in the event that there's some issues that they can be resolved prior to, because you don't need that extra stress getting to class and then trying to download that exam and then run into issues. But nevertheless, if you do while downloading the exam run into issues, be sure to call ExamSoft. They're pretty quick about resolving and assisting us with issues as they arise. You do want to make sure you have your identification, your two devices, and your chargers for both, just in case. Sometimes these devices are charged, and you never know when when they'll run down and they'll need to be plugged back up. The other thing is also if you're expecting to get that exam proctored, remember that 72-hour notice, that approved faculty member from the campus dean, and all of that needs to be communicated to whomever the professor is. All right, so let's go ahead and get started. I think that's all our preliminaries for. Right here. Okay. So, and also be sure to go back through your classroom recordings. And also there are 4 of us, so make sure you go through the exam review recordings as well. Okay. So active listening, establishing this therapeutic communication is important. In order for us to be able to provide that best care for our clients. And you will hear therapeutic communication, you'll hear assertive communication, because remember, assertive is not aggressive. Assertive involves expressing ideas and opinions openly, but while remaining respectful. And in addition to that, we're actively listening. We're being quiet and we're listening to the other person. All of those they kind of play hand in hand. And then meanwhile, while we're establishing those therapeutic relationships, while we're actively listening, the patient is expressing what is important to them. We are being respectful to them and their ideas and what they actually value. And then they're more apt to discuss things with you in the event that they don't agree or don't want an intervention that we're trying to implement. They'll be more forthcoming. And we do want that. We want them to share their ideas because we want to improve, and provide that best care that we can. So we want to discuss that with them. So we want to encourage that, and we do that through active listening. Okay. So remember, there is a sender and a receiver when we're interacting with each other. And so we want to ensure that we are alert. We're actually pausing to listen, watching verbal and nonverbal cues. We want to use I statements because that is it's more of, it's assertive communication. It's considered therapeutic communication. It allows the person to express their thoughts and feelings and needs clearly and directly. We want to include nonverbal cues and also question, in the event that they're stating something and their reaction or nonverbal cues don't exactly match. We do ask questions, not in a aggressive manner, but we use I statements. I noticed that, as you were stating whatever it was, I noticed that there was some facial grimacing or just a change in your emotion or something like that. So that is again assertive communication. It involves again looking at those verbal and nonverbal cues. Now, if a person now when we're being assertive, we want to use eye contact. We don't want to use glaring eyes or staring at someone. We want to be careful that we're not giving off that nervous energy. And sometimes people laugh, so we don't want to uh, do that nervous laughter, because then that can undermine or just change the whole feel of things. So be careful with the nurses' nonverbal cues as well. Nervous laughter is one of those things that people tend to do when they're nervous. So just make sure that you're nice and calm, refocus. You want to maintain that eye contact. You want to speak clearly when you are communicating. So these are just some techniques right here that we can keep in mind. Like I mentioned earlier, while they are talking, we can just be quiet. Remaining silent is positive. It is active. It allows that person, they will feel that you really do have their best interests at heart because you're just listening to them. And nevertheless, you can gain understanding of what they understand, what they know, what their values are, and what their goals actually are. So, and so another thing that we use a lot too is we want to restate, repeating what they say, because we do not want to ensure that what the patient is actually saying to us is really what is being communicated. Because there are some times when information is received incorrectly and it's not what they actually intended. So we're going to restate to clarify, what they're actually saying. Okay. We just talked about this using those iMessages, establishing that eye contact, being aware of our own body language. These are all positive communication techniques. Now, the one that the patients don't really know, but because you established that therapeutic relationship with them, they want to know, what do you think? So, but we got to be careful with giving advice because that's consumed as negative. We want to ensure that our patients have enough information so that they can make an informed decision. We want to be respectful with our communication, ensure that we're not blaming. We want to demonstrate active listening. And in the event that a situation seems like it may be getting, out of control or out of hand, we want to try to de-escalate that tension by refocusing, restating, just to gain clarity of what's really going on. Because a lot of times it is something else. It's not even, why we're communicating to our patient, the reason why we're communicating to them, and the patient gets upset or something, it has nothing really to even do with that. So that's why we want to refocus, ask those clarifying questions, and consider those positive communication techniques as we integrate, as we take care of our patients. Okay. All right. So as far this is a structured way, it keeps our communication structured. It helps us so that we don't forget anything as we are communicating and collaborating with those on the healthcare team. So while we are talking to the physician or the healthcare provider, we give similar information as though we were doing handout. But with the physician, they want to know, of course, situation, but why are we calling? We want to include who we are, the patient's name, and their problem. That's the situation. Why are we actually calling? And then we want to the background. They need to know as much information it is, because more than likely this is not an in-person conversation. This is over the phone. So keep that in mind. And then our assessment, what do you think is going on based on the findings that you have? Okay, right here, let me go back to background. When you're giving background, you want to give the most current vital signs, and you can also give the previous one or two just for comparison as well. And then recommendation, what is the goal of care? What needs to happen so that this client's need is met? Is it a transfer? Does this patient need a new medication order, or a consult? Okay. So we also use the SBAR when we are changing shifts or doing handoff reporting. And this is nurse to nurse. Again, it's just a way that we could collaborate and communicate within a structured way. And so most of the time, a lot of facilities have what we call like a cardex, and the information that we're inputting along the way in our charts. At the end of the shift, you can print in the cardex pool whatever preset topics that are actually there. But at a minimum, it includes these things. We're handing off, why they were admitted, some background about the patient. It'll also list the last couple of vital signs, finger sticks and things like that. It'll pull that out. But nevertheless, it helps us to communicate and not forget anything, because remember, communication is an essential piece, you all, in improving the quality of care that the patients are actually receiving. Communication. And then it dominoes. If communication is effective, if collaboration is effective among the healthcare team, then there equals a decrease or reduction in healthcare costs, because we've already talked to our patients. We know what they understand. We know what their goals are. We've communicated with the others on the healthcare team. We know this person has physical therapy. We know this person needs to see the dietitian. We have communicated and collaborated. That leads to better outcomes, and better is a decrease in healthcare costs. That's one tool that they use to measure that. But how we know we had best outcomes? Well, we had the decrease in readmissions, and the healthcare costs were at a minimum. Now, sometimes they say conflict is just a natural part of life. And so facilities have what they call as an ethics committee. And so hopefully the conflict can be resolved prior to going to the ethics committee, but sometimes it can't. But nevertheless, we want to ensure that we're gathering all of the information that is needed, because a lot of times when we step back, as I mentioned earlier, what we think the issue is really not the issue. So we want to ensure that we gather all information that is needed. Because remember, these organizations, the hospitals, the urgent cares, they're in business for growth. So they want to resolve conflict. And sometimes resolving the conflict identifies and brings to the light of some issues or processes and procedures that need to be refined. So organizations, they want to solve the conflict. They don't want it to just go unresolved, because that leads to their growth and and learning as a facility and as a healthcare organization, because that's why they're there, to serve the people. And so conflict comes up, but it's really important that we are clearly communicating and also gathering all of the information so that this conflict can be resolved. So there's a quote in your required reading. It says, tools to reduce conflicts include clear communication and the ability to work well as a team. Doesn't mean we're breaking rules for each other. It just means that we understand what the rules and the expectations are. We understand what our Nurse Practice Act are. We understand the policies and procedures of that facility. We understand that we're not the only ones on the team. And there's usually multiple healthcare team members that will take part in the patient's care. So tools to reduce conflict include clear communication and the ability to work together as a team. And this is also a tool that we use to enhance our communication while we're in the workplace. We got to have that effective communication, in the event that, a process or procedure is not the best. We need to be able to feel comfortable and be able to communicate that. We don't need to just let things spiral out of control. So we want to encourage open communication between all of those that are on the healthcare team. We want to encourage open communication with our patients as well. And in the family members, we don't want to violate HIPAA, but we do want to make sure that we're encouraging that, because remember, it's the patient that's receiving the care anyways, and they have to accept it. They have the right to refuse. So the chain of command in the healthcare facility, we want it to be followed, but there are sometimes when we can't follow that chain of command, and that is in emergencies. While the chain of command is important for organizational structure and communication, it should not oversee urgent patient care and safety concerns. So we have something going on. It could be, let's see, we discover a fire or potential situation where family members and the patient maybe looks like they're going to have a confrontation. We're calling out for whomever that's right there in the event that the patient, they're complaining, their blood pressure is extremely elevated. We need to talk to that doctor immediately because we need an immediate response. And so an immediate action is necessary. So that's the thing. We usually follow the chain of command, but if an immediate action is necessary, that means emergency situations, then that's when we will forego or really not follow the chain of command. We will bypass the usual chain of command and notify whomever can resolve and give us immediate instructions as what to do to keep this client safe and take care of the urgent need. Okay, kind of already started talking about assertive and with that therapeutic communication. Assertive is the opposite of aggressive. Assertive is being respectful. It is following through with whatever that you said that you were going to do, is being honest. It is, and aggressive is the opposite, is being rude and disrespectful. Now, non-assertive is where we are just passing the buck. We're not giving them, and it's also really considered as being disrespectful. A patient asks a question. While we can't answer that question justifiably, we can seek out someone that can, rather than telling the patient, "Oh, don't worry about that." We need to seek out whomever that actually can resolve that issue. So again, remember, assertive communication involves expressing ideas and opinions openly while being respectful of others. And aggressive is not all of those things. Disrespectful and being dishonest. Okay, so there are several of us on the healthcare team, and we work together to meet that common objective through communication. We keep going back to communication. Can't get around that communication. And so we have many that are on the healthcare team. We have the nurse, we have the healthcare provider, which usually is their main doctor. We have the most common ones in LTC facilities. We see speech therapies. They're all things speech and swallowing. We see the physical therapy that in occupational therapy, they're for movement. All those activities we do daily, they coordinate and try to get those patients back to their optimal level of care. We have the respiratory therapists. You'll see those a lot of times in a lot of the facilities that we work in. And it's all things respiratory, breathing, lungs, airway. That's the respiratory. And so we do have different types of physicians. We might have and they will specialize in whatever their specialty is. For example, you might have a surgeon. You might have that radiologist. That's the doctor that reads the radiology reports. That surgeon, of course, does the surgery. And also they're the ones that's going to be responsible for that after surgery care. So think about that pain, medication, when did this patient get up and move around and things like that. Nevertheless, we have to have effective collaboration and communication among all of those that's on the healthcare team. And this involves active listening and then sharing that patient information. That leads to that continuity of care. Our patient is getting ready to be discharged from the hospital. They go into long-term care facility. Our patient's getting ready to be discharged and they're going to home. So they're going to need home health. It's going to be key that if we're on the receiving end, that we're actively listening. So the information we get, we understand it, and also so we can ask questions. Because remember, we want this care to be as seamless and continuous as we can, because we want these clients to get back to their optimal level of actual care. If they were up and about, whatever that their optimal level is, we want them to get back as close to that as possible. Okay, so these are just different methods or strategies that are used in facilities to meet the care of their patients, and what managers or DONs and things like that do, they consider, and they may use several of these in facilities, but they will consider the staff that they have. They will consider the number of patients they have, and all of that. And that helps them to decide which way do they need to approach delivering this safe patient care. There's a total patient care. You do everything for the client. You feed them, you bathe them, you give them the medications, you do their treatments. And, team nursing, each person is assigned to a specific task. It's not that the people on the team can't do all the tasks, but, sometimes it just depends on your mix with the patients, what that facility deems is best so that care can be provided. Like we mentioned early on, we want to be respectful. We want to identify what the client's preferences are. What are their needs? What do they understand about their care, and what is we actually required? This is another way of breaking it down, looking at those nonverbal cues. What does this mean? And verbal cues. What does this information mean that this patient is giving me? So we create and try to come up with that care plan for that patient and solutions, those interventions. Then we implement them. Then we come back and evaluate it. Did what we do, those interventions that we implemented, did it do any good for the patient? So we want to be always, as we go in and interact with our patients, we're looking and analyzing. We're always reassessing. At a minimum, we go in every 2 hours to check on our patients. But should be observing for any patterns, any changes, any changes in the level of care that they actually need. So QSIN, it is the initiative that anticipates that collaboration will have a major impact on positive patient outcomes and improve quality of care. So quality and safety education for nurses, it literally is what it says it is. Like some of these titles sometimes that match what they actually do, but it's the initiative. And the whole point is so that patients can have that best care, that outcomes are improved, and they have that best quality of care. And this slide is just showing, hey, it takes all of us collaborating and communicating on the healthcare team to pull everything through for the patients and keep ourselves safe too as well. So let's read through this. Management and leadership. Management is coordinating people, time, and supplies to achieve desired outcomes in a defined area of responsibility. Have an appointed management position and formal line of authority and accountability. Management is transactional. Transactions are done to complete whatever it is the goal is. Leadership is transformational. Leadership, of course, we're going to take care of the patients. We're going to complete all the tasks. But in that, we identified if there need to be new processes, if processes needs to be revised. We've promoted our team members to seeking out certification. It's transformational. So it's a step up from just managing care. This is just another slide showing that. So delegation, make sure that we look at these delegation tasks. We can delegate to unlicensed personnel. Unlicensed personnel cannot delegate to other unlicensed personnel. While we are deciding whether to delegate or not, this helps us to decide. Let's just make sure that the person is correct. The person that we're getting ready to delegate to Is this a skill that they can complete safely? Are they qualified? Are they competent? Okay. Is the patient, are they stable or unstable? Because remember, even if it's a task the UAP can't complete and that patient is unstable, we're not delegating that task to that to the UAP. What is the task? And then make sure that we're communicating the correct or right directions and instructions clearly. And then, we have to still go back and evaluate and assess to ensure that what we delegated was actually completed. Okay. So know your and their scope of practice before delegating. Is this a skill that the person can competently, is it on their list that saying that they can actually complete this? Even you, if someone's delegating a task to you as the nurse, and your state practice act, even though they're delegating it to you, if it's not within your scope of practice, if you have not been checked off on it, so to speak, if you have not been deemed competent to complete it, do not accept it. We can refuse delegation, but they will ask, well, hey, why are you refusing? Well, hey, this is not a task on my to-do list. Lawfully, I cannot complete this task, or I haven't been trained on this task. Okay. Are there any questions? I'm going to check the chat. You've placed your name, campus, and professor there. Are there any questions, you all? As I mentioned before, go back to your classroom recordings, reach out to your professors. If there's a question about a concept, you can jump on the phone. You can communicate via email, Zoom, or what have you. But don't go into exam 2 and not have a question answered, because we don't have to automatically, go on Zoom. It could be a phone call, but nevertheless, reach out if there's a question or concern about a concept. This recording will be provided as soon as it downloads and uploads. You all take care.